Okay, so in this video, we are going to see about what is peritonitis, our topic for today. So peritonitis, if we see about the introduction, it is either the acute or the chronic type of inflammation of the peritoneum, the membrane that lines the abdominal cavity and the visceral organs. And inflammation जो है, it can extend throughout the peritoneum or it can be localized as an abscess. So you can understand that inflammation that can be either throughout or it can be localized, and that localized as an abscess. Peritonitis, it commonly decreases with intestinal motility and it cause intestinal distension with gas. Here, the mortality is about 10% with death that usually occurs due to bowel obstruction. Causative organism generally, that is pyogenic bacteria, E. coli, and the aerobic and anaerobic streptococcus and the staphylococcus. So if we see word to word definition, that is, it is the inflammation of peritoneum, that is the serous membrane that lines the abdominal cavity and the viscera. So once again, inflammation of the peritoneum, the serous membrane lining the abdominal cavity and the viscera. Next is causes. It can be either external cause or the internal factors such as injury, trauma, wounds, either it can be gunshot or stab wounds, inflammation, bacteria, perforation of the gastrointestinal organs, or dialysis, that is peritoneal dialysis. So these are the causes which are seen in cases of peritonitis. If we see about the pathophysiology, there are five main steps. First one, that is leakage. Second is proliferation. Third one, that is edema. Fourth one, that is invasion. And the last, that is the response. So if we see about the leakage, it is caused because of the variety of leakage of contents from the abdominal cavity. Proliferation, where the bacterial proliferation occurs as a next step. Edema, because of this proliferation, edema and the exudation of the fluid that develops in short time, right? So that leads to edema. Now it leads to invasion, that is the fluid which is in the peritoneal cavity, it becomes turbid with increase in the amount of protein, WBC, cellular debris, and blood. Response, the immediate response, that would be of the you can say intestinal tract, that would be hypermotility. Soon it will be followed off by paralytic ileus with an accumulation of air and fluid in the bowels. Okay, so this is about the pathophysiology. Clinical features, if we see in case of peritonitis, that is swelling and tenderness, which is seen in cases of abdomen. There will be fever and chills, loss of appetite, nausea and vomiting, pain, shallow breaths, and low BP. Limited urine production and inability to pass flatus or feces. That is because of decrease in intestinal motility, right? What says in diagnostic findings? So diagnostic findings, first of all, we will find that there is increase in the amount of WBC. Second is we will go for serum electrolyte studies. Serum electrolyte study, there will be alteration in the level of potassium, sodium, and chloride. Abdominal x-ray, it will show air and fluid levels, as well as it will help in showing distended bowel loops. Next is this thing that is about abdominal ultrasound. Abdominal ultrasound will help us in diagnostics of abscesses and fluid collections. CT scan, again for abscess formation, and MRI. MRI, it can be useful in case to diagnose intra-abdominal abscesses. Complications, three major complications that are seen with peritonitis. One is sepsis, second is shock, and next is intestinal obstruction. Management, it can be divided into two parts. One is medical management and the other being the surgical management. So medical management and surgical management. First of all, we are going to talk about medical management. So medical management, fluid, colloid and electrolyte replacement. Fluid, colloid and the electrolyte replacement, this is the major focus of medical management. So fluid is to be given, analgesics, intubation and suction, and this is to relieve the abdominal distension and in promoting the intestinal functions. Oxygen therapy, it is to provide or to promote adequate oxygenation. And the next is that is antibiotics, it is to initiate the treatment in peritonitis. That is, it is very early initiated for the treatment of peritonitis. And if we go for surgical management, that is exploratory laparotomy, excision, resection, and fecal diversion. Okay, so that's all for peritonitis. Thank you and hope it proves useful to you.